How are urinary problems and Parkinson's disease treated? Urinary problems can be a challenging aspect of living with Parkinson's disease. Many individuals experience symptoms like urgency, frequent urination, nighttime urination, and urge incontinence. These issues stem from how Parkinson's affects the nervous system, which controls bladder function. The goal of treatment is to manage these symptoms effectively to enhance quality of life. Initially, healthcare providers often recommend behavioral therapies. One effective method is bladder training. This technique helps individuals learn to suppress the urge to urinate, gradually increasing the time between bathroom visits. This can help the bladder hold urine longer and reduce the frequency of urgent trips to the restroom. Another approach is timed voiding, where patients urinate on a fixed schedule, regardless of the urge. This can help regulate bladder function and lessen urgency. Pelvic floor exercises, commonly known as Kegel exercises, are also beneficial. These exercises strengthen the muscles that control urination, improving bladder control and reducing leakage. The neck maneuver is another technique where individuals contract their pelvic muscles before actions that might trigger leakage, like coughing or sneezing. These behavioral methods are generally low risk and are often the first line of treatment for urinary symptoms in Parkinson's disease. If these strategies do not provide sufficient relief, medications may be prescribed. Antimuscarinic drugs such as darafenicin, oxybutynin, tolterodine, and sulifnacin are commonly used to treat overactive bladder symptoms. These medications work by relaxing the bladder muscle, which can help reduce urgency and frequency. However, caution is essential, as these medications may worsen constipation and dry mouth, which are already common issues in Parkinson's. They can also affect cognition, particularly in patients with cognitive impairment. For those experiencing excessive nighttime urination, known as nocturnal polyuria, desmopressin can be an effective treatment. It helps manage this specific symptom. In some cases, advanced treatments may be necessary. Botulinum toxin injections into the bladder muscle can help reduce overactivity, but they do carry risks, such as urinary retention. Neuromodulation therapies, which involve electrical stimulation of the nerves controlling the bladder, are also emerging as promising options for those with persistent symptoms. Lifestyle modifications can further support treatment. Staying adequately hydrated, avoiding bladder irritants like caffeine, and managing constipation can all contribute to symptom relief. Timed voiding and bladder training can also be integrated as lifestyle strategies to improve overall bladder health. For a comprehensive evaluation, referral to a urologist or bladder specialist may be necessary. This can include tests like urinalysis, ultrasound, and urodynamic studies to rule out other causes and tailor treatment plans effectively. In summary, urinary problems in Parkinson's disease are managed through a combination of behavioral strategies, medications, and sometimes advanced therapies. Early intervention with bladder training and pelvic floor exercises is common, progressing to medications if needed. It's crucial to balance the benefits of treatments with potential side effects. Seeking specialist input can be valuable for complex cases or when symptoms persist despite initial treatments. Always consult healthcare professionals for personalized advice tailored to individual needs.